guys, my colleagues, faculty, students, and of course freshers. You are no more freshers, already done more than I think October, means you are taking exam in July. So you are probably no longer freshers, but I think we will still consider you freshers. So I just want to know, I'm sure you chosen the right profession. Anybody have second thoughts that you are not in the right profession? Anybody? No, that's very good. You chosen the right profession. I can assure you, this is the best profession. And also, have you ever thought whether you are in the right place or not? Anybody? You are in the right place, right institution, as my brother and Dr. Joshi said. This is the best place to become a good doctor, a successful doctor, because you have everything here to become a good doctor. And we have the ability to bring out the talent in you. You can see your seniors, how they organize and how they analyze you. That's innovation. They read about you, they studied, the way they commenting about each and every one. That shows their dedication on every individual. That's what you need in medicine. If you're dedicated, your observation, that's the result. I must congratulate them, your senior batch, immediate seniors, for a great job. And you should be doing that soon. Probably next year, we should do the same for your freshers. As Joshi said that this is the best institution for results. He was sending me the pictures of people who are selected in residencies. Other day, they think there's a list of on the website. There's a list of doctors selected for residency program in 2025. The point of view from SVS, given under so and so name, SVS Medical College. So that's the opportunity, that's the, what is that, you have the ability to become one of those. And as my brother said, probably you already settled, we are quite friendly. Management is directly communicating with you. There's nobody in between. In some of the organization, there may be people in between the management and students. You can come to us anytime. Any problem, any improvement, any discussion, anything you want, you can come directly. And on behalf of all of us, our brother Ram Reddy is here all the time, round the clock. As Kanakaraj said, he is dedicated, available all the time, and he can give very good advice. He was the main advisor for me to become what I am today. He used to take me for all entrance examinations. He used to accompany me wherever I go for admissions. So he's a big inspiration for me and should be for all of you. And I think we have, I'm sure most of you know the facilities we have in SVS Medical College. I'll just tell you about the recent MRI scan. Previously, people used to get scared to get an MRI scan because you are going in the tube, you have claustrophobia, and it takes very long time. Most of the MRI scans will take about 40 minutes you have to lie down still in the tube 40 minutes. We have one of the latest one, Tesla with the latest compression technology. It will do MRI of brain in 5 to 7 minutes. And then big tube, the standard one will have 50 centimeters is a 70 centimeter tube. So you can see there's a gap between your face and the tube. You don't feel claustrophobic. Similarly, we have so many facilities, operation theatre, emergency. We placed an order for one of the latest cath lab going to be here soon. So we have so much of facility, infrastructure, along with the faculty to make you good doctors. That shows the management dedication to support you to make you good doctors, provide you the great facilities. Because end of the day, many people wouldn't have seen SVS. It's only you who bring us the fame. When we go out, people will talk about, oh, he's from SVS. That means he's good. Other day we were saying in Apollo, I think people are here. In orthopedics there are about 7 people from SVS. If we take entire Apollo, other day, entire gastro departments, significant number are from SVS. Anesthesia department, cardiology department, so many from SVS, because anybody post-graduation or undergraduation from SVS taken like hotcakes, because they know that SVS students or postgraduates, graduates are trained well. They have patience, they have the infrastructure, they have the faculty to train them to be good doctors. So you have, when you come out, you will be a popular doctor already because you are in SVS. And you should work hard to keep that name. And as Chairman was saying, I think we come all the way. That shows the dedication of the management to be here, part of your happiness, your celebration. Though busy, everyone is busy, but they want to spend time with you. We could have sent some other people to do this function, but personally came here means we are interested to make you good doctors. And of course, avidya means innovation, is it? Innovation. Innovation is the key for modern medicine now. Whatever there when I studied in 1980s is gone. Previously we used to do 1.5 year anatomy and we used to dissect entire body. And Joshi was saying why I was forced to do dissection was, see, everyone used to wait. When body is allotted, people used to wait most of the stages. So somebody else expose some nerve. What happens when you're exposing, you might damage. So they want to wait and see who is going to expose first. So they want to see them and do the dissection so that they can do a proper dissection. That's how our team, our stretcher mates, we used to take the lead role, work hard before and do a proper dissection, expose the important structures and do a proper dissection. That motivated us and become very popular that we are the first one to expose any part or dissect any part. And everybody used to come. My professor was Dr. Hari Kishan, and of course Srinivas Reddy was here. They were our teachers that time. They used to call everybody, show our specimens, dissected specimens. They used to feel so proud. So it's important to be leaders, to be innovative. And last time also we were saying artificial intelligence is going to take over even in dissection. You might have seen, it will show 3D pictures like anything. Yesterday I think that Apple released new iPad with AI integrated software. So artificial intelligence is going to take over, even in medicine. So you should be aware of the technology. And we have excellent skills lab in the college. Have you been to skills lab? First year they don't go. So you can do like putting a cannula, putting a tube, resuscitation. You can see and get the feedback whether you're doing the right thing or not. So you must utilize skills lab like simulator to become experts in whatever specialty. And our chairman was saying about anatomy. Anatomy is the backbone. These three subjects, anatomy, physiology, biochemistry, will never leave you. As long as you are a doctor, you have to go back. Even now we read about anatomy. Any difficult operation, we go back, check what is the normal anatomy. To expose parts, we have to expose without damaging normal anatomy. So anatomy will stay with you rest of your life as long as you remain as doctors. Very important, these three subjects. As you know, if you taste the food, how do you say whether it's good food or bad food? If you say it's not nice, that means you tasted something better than this. These three subjects are like that. Unless you know the normal anatomy, normal physiology, normal biochemistry, you will be knowing what is abnormal. And the next level, that's MBBS 2, you read about abnormalities in anatomy, abnormalities in pathology and biochemistry. And these two put together, you read in MBBS 3. And all these put together, you practice as intern and the rest of your life. So these basic subjects are very, very important, and you can never leave them. If you want to become a good surgeon, you have to be a good anatomical student. Once again, congratulations, all the best. Have a great time in SVS and a great evening. Thank you.
He scored 704 marks out of 500. And the top one is 705 marks with Pranit Sai.